I am president of Disability Voices United, which is an organization directed by and for people with disabilities and their family members. So I want to thank you for coming. We meet every single week. Ed, do you mind, I'm seeing on my screen the Spanish interpreter. Do you mind pinning me right this second? And then you can pin Susie when I'm done.
Sure.
So thanks everybody for coming. We meet every week right now. We're going to go to every other week in September, but we meet every week, and you can find all of our previous SDP Connects on our Interchange website, which if you go to the Interchange, all one word, theinterchange.org, and choose, we have two interchanges. If you choose the self-determination interchange and look for SDP Connect, you can find all the previous recordings of all of the SDP Connects we've had. We also have written a couple of books about the self-determination program, which we might refer to today. And we will definitely, we can send those to you if you can order them on our website. And I think Ed will put in the chat how to order our books. So I want to get started because we only have a little bit of time of our guest speaker today, and I want to make sure that she has time to make her presentation. I want to really thank Susie Rickworth, who is the head of the self-determination program at San Diego Regional Center. Susie and I were meeting last week with one of our staff, Molly Kennedy, and she had, first of all, can I just say, one of the more enlightened regional center staff on the self-determination program, and really had just amazing vision for understanding that people are in charge of their own lives who are in the self-determination program, and that her job is just to support us, to make our lives as good as we can make it. So she agreed at a very last minute invitation to join us and explain, at least at her regional center, it's different at all, but at least at her regional center, how they think about unmet need, since we spent a lot of time last week talking about it in detail. So I appreciate you joining us, Susie, and take it away.
All right. Well, thank you, Judy, and hello, everyone. I know some of you are familiar, your names are familiar, so you may have had the misfortune to be in a meeting with me in the past, but hopefully you don't remember it that way. But it's good to see everyone, and I appreciate you being here. Like Judy said, I want to talk a little bit about how we develop budgets with the team through San Diego Regional Center for people that are transitioning into self-determination. And I'll make a couple comments about the conversation moving forward after that first year. But we'll focus on that first year in self-determination and what that budget process looks like. So I'm going to go ahead and share my screen because Microsoft PowerPoint just did a great job with giving me the visuals for today. Everyone who's seen these slides said the visuals were great, and I wish I could take credit for it, but it was really PowerPoint that told me what to do. So 1 point for Bill Gates. All right, so like Judy said, I don't have a whole lot of time to be with you guys today, but I do want to give you this information. Anytime I talk about the budget, there's always questions that come up. It's a big part of self-determination, and I think we all understand that. So if there are questions that come up, please put them in the chat, let Judy know or someone here know that you have them. And if it's something that I can give information on after the fact, or, Judy, feel free to reach out to me if you get like some consistent questions that you think maybe I could provide some additional information on. I would be happy to get back to the group, because I know you guys are here most weeks. So I would be happy to try to get any follow-up information if I can. All right. So now I know you guys, for a lot of you here, you're here every week. Judy's obviously very knowledgeable about self-determination, and you probably have a really good idea what the Landerman Act says. So I'm not gonna spend a lot of time educating everyone on the Landerman Act. You know this stuff, most likely. But I did bring it up because I want to just set the stage for the perspective from a regional center of what our responsibility is in the budget process. And we're looking at the same Landerman Act as everyone else. So this is our starting point. We look at that law and we say, okay, individual budget, it's the amount of regional center purchase of service funding. So all the money we spend on services and supports necessary for someone's IPP. So we've all got that understanding of the general principle of what the individual budget is. But the next line in the Landerman is really important. That's where it says that the individual budget shall be determined using a fair, equitable, and transparent methodology. I'm an optimist. I like to think that everyone comes to the table believing in this, right? We all come there wanting things to be fair, wanting things to be equitable. We want to understand how it's happening, what the process is, transparent. And it says so in the law. So we've got all of that going for us. But there's not a lot of information. There's some, and we'll talk about it, but there's not a lot of information about how do we make this happen? How do we make sure that the budget is being developed in a way that's fair, equitable, and transparent? So just briefly, we'll look at there's a few other things that the law tells us, and these are the things that as a regional center, I'm paying attention to. It tells us we're going to look at the last 12 months of expenditures, right? So what happened in the last 12 months? How much money was spent on services and supports? And then let's have a conversation about any changes in circumstances, changes in needs, changes in resources, all of those things, new needs, maybe needs and resources that were unaddressed in the individual program plan, IPP. And then at the end of it, the regional center is certifying the budget. When you get a budget form from your regional center and it's signed, basically what we're doing is we're signing and saying, we're confident that this is an amount of money that this regional center would have spent on this person's services and supports in a 12-month period, right? So that's what we're signing off on. So at the end of it, that's what we all want to be in agreement on is this an amount of money that reflects what would have been spent if this person or you or whoever had not gone into self-determination in the first place. All right. So, but beyond that, that's what we have to work with. That's what we're all working with here is, okay, now how do we make this happen? So what I want to show you guys, and again, every regional center does this a little bit differently, maybe a lot differently. There's 21 of us. I don't know if I've ever met 21 people that all do something the same way. But I want to tell you how we walk through the process in San Diego and why we do it the way we do, just so, hopefully it gives some ideas on what the thought process is behind the conversation. So we have a budget form that we use here, and I'm going to show a couple of snapshots of it so that you can see how we guide the conversation. It's not the DDS budget form that was released, three years ago. At the beginning. I think that's a good example of a tool that we all wanted to have something to hit the ground running with that would help us. But then when we actually hit the ground, we realized there's a lot of things going on in this conversation. And so from that form, tweaking it to say, all right, what really works for this conversation? So it's not like a complete departure from what DDS has provided in terms of guidance, but it's tweaking it based on our real life experiences. So in San Diego, we split the conversation really into two parts. So we're going to talk about the last 12 months. And you'll notice on the slide here, I specify that it's conversation in both parts, which I'm referring to as tables because that's what they are in the form. They come up as tables. The conversation component of the budget process is critical. So in an ideal world, right, where nothing has changed in the last 12 months, rates for services are the same, you were able to use the things you needed, et cetera, et cetera. There wasn't a global pandemic, for instance. The last 12 months would be the perfect reflection of how much money is needed for services and supports in your life for a 12-month period. But the conversation piece is so important because the last 12 months, that initial number often isn't going to be the final number, right? Because there's so many different factors to talk about, mostly those changes in circumstances and needs, and et cetera. But we're going to start there. And then the table B, that's where we get into the next 12 months. And again, bringing it back to that conversation. What does the next 12 months look like? As a team, how can we agree on what's appropriate, what meets the needs of this person to the best of our ability, right? We're working in the future, so there's always a hypothetical component to it. So as a team, we really have to work together to figure out, what does this look like in the next 12 months? Okay, so again, San Diego specific form. All regional centers have a form that may be similar to this or may be very different, but this is that table A, the first part of the conversation. So for those of you who work with a regional center that uses SanDisk, which I'm not sure if you guys may not know what that is, but there's some regional centers that get all of their information from a certain computer system. And that program is able to generate what's called a 12-month expenditure report. And it comes out looking like something from like the movie 1984, right? It's just numbers everywhere. It's not very well organized, but all of the information is there. So what we do here is essentially we're just taking that information and we're transferring it over into a table that hopefully is easier for everyone to process and talk about. Certainly easier for me, certainly easier for service coordinators. And like I said, we hope that is the case for everyone. So we're not creating new information. We're just taking what's there and putting it in a format where we can have a productive conversation about it. So we'll get that expenditure report, and everyone here will also have that expenditure report. It's not a secret document. It's, everyone has access to that expenditure report. However it is their regional center generates that. And we're going to organize that information into each service. What did it look like in the last 12 months? Was it something that was used all year? Was it something that was maybe only authorized for a few months? How much was authorized? How much was used? So all of that stuff will be there, and we're just going to put it into this table. And the most important conversation, at least I think the meat of the conversation here, is this second to last column that says status for next 12 months. So every service that's on the expenditure report, it's either going to be something that as a team we say, yeah, that makes sense that this person, you, would continue using this service for the next 12 months. And then we can talk about, in this case, is the amount you used in the last 12 months, a good reflection of what you would use, or do we need to have more of a conversation about that, et cetera. But the first question is this something that would still be a service regional center could fund for you to continue meeting the goals that you have for yourself? So it'll either be continuing or some things discontinue. A really good example, at least I hope this is a good example, I'm not sure right now, would be services that were related directly to COVID. Hopefully those are all things that are discontinuing. It's a little bit, we're really not sure right now, but long-term, that's probably something that is a temporary need, a temporary service that's not reflective of the world in general, right? It's a very specific moment in time. So that would be something that maybe would be discontinued. And then there's a third category here, and that would be any services that continue outside of the budget. So the things that, you can see the list on the DDS budget form, SSP restoration, ABA co-payments or co-insurance, insurance co-pays, sorry. Those types of the things that we can continue paying, we meaning regional center, that we can continue paying separate from self-determination. So every service on your expenditure report is going to fall into one of those three categories. I have yet to come across one that doesn't fall into one of those three categories, but just in case, there's also an other option so that we can talk about it if anything else comes up. But so far that seems to be pretty descriptive of what you're going to see on an expenditure report. All right, and there's the additional information column at the end here. I put these two up, I highlighted these because this is what the conversation is, like I talked about. Do things continue, discontinue, continue outside the budget? And then there's that additional information column so that we can, after we have that conversation, we can put a note in there that says like, some of this respite or whatever service it is, every regional center has services set up a little bit differently, was related to a COVID need that no longer exists. You know, we can put a little bit of info in there to describe why maybe we marked something as continuing or discontinuing, but we're doing this together. Like, this is the team sits down and does all of this together. All right. So then we get to, I hate to say the fun part, because most people don't think anything about budgeting is fun, but I would call this part the fun part, because this is where we're thinking ahead. We're thinking about the next 12 months. We're looking at that person-centered plan, if you've got one developed. This is where all of that information comes in. This is where we talk about what's happening in your life, what are the things that we know are continuing, and what else do we need to be taking into consideration. So kind of building what we call it a traditional services blueprint, building this blueprint for what traditional services as a regional center, either we are funding, or if it's a new need, we would be funding in the next 12 months, right? It's not always an easy thing to determine, right? In the hypothetical world of the future, we can't always know for sure. And so again, that's why it comes back to that conversation. Let's talk about what makes sense for the next 12 months. And so we're going to have that conversation. Anything that we've already talked about from table A, anything we talked about there that we marked as continue, we're going to put that down here. We've already talked about it. We know it's something we would expect to continue funding traditionally. And I think you guys have probably picked up on this, that I didn't define at the beginning. When I say traditional services, I mean anything not self-determination. So basically services you have now if you're not yet transitioned into self-determination. So we're gonna categorize the next 12 months into two different kinds of services. There's services that as a regional center and as a team, we would all agree are things we would continue to fund until there's a change in that person's life. This would be things, at least from San Diego's end, like respite or day services or independent living supports, right? Some of these things look different in different parts of the state, but from San Diego, those are some things that if I saw that someone had that service in place, I would anticipate, and we would have a conversation, of course, but I would anticipate that's something that we're probably going to expect to continue funding until something changes in that person's life. So it's an ongoing service. And then there's another category of those one-time or temporary services. So things that we know, and again, we're still talking about traditional services here, things we know would only be one-time or temporary expenditures. And sometimes those are things that we may end up continuing again, but in that moment, we don't know if it's something that we would anticipate funding over and over again. So depending on your regional center, this could be, you know, some regional centers will fund behavior services in time-limited chunks, depending on that individual circumstances. We might not know if that's something that's going to continue, but we know it's a one-time thing that the team has all agreed is appropriate right now. So that's why we would put something like that in a one-time or temporary service category. So we know we need to come back and talk about, does this still make sense for you, for your family member, in terms of what's coming next. So we're going to differentiate between those two categories. And this is where we'll take into consideration rates. You know, rates change a lot. Many of you guys know that there's some rate changes coming down the pipeline. In the next several years, there's going to be a series of rate changes. So, you know, we're going to talk about that. What do we know now? What, you know, we may know there's a rate change coming at some point in the future, but we might not know yet, right? So we'll talk about like, hey, how do we come up with the amounts for each of these services and go from there. And after we fill out that table, then you have this nice little putting it all together chart at the end where we're just adding together those continuing and ongoing services and the one-time temporary services, and you get your grand total, which would be the budget for the next 12 months. And you don't see it here, but right after this is the part where everybody signs. Regional center says, yes, we feel that if we needed to justify it, we could say, yes, we expected to spend this money. And then you can move forward with developing your spending plan with that money. All right, and before, I guess I like to talk. Before we wrap up, I'll try to just go through this quickly because I don't think very many people, actually I know not very many people are to this point yet, but I think it's a good thing to have in mind that after your first year in self-determination, you have that initial budget. You're going to calculate another budget. You're going to develop another budget, second year and beyond. And that conversation is going to be a little bit different than that first budget, right? The first time you're going into it, you may have traditional services that you can look back and see what you used. The circumstances in your life might be changing because you're changing how you're coordinating your services and supports, right? Like there can be a lot of things going on during that transition phase. When you get to the second, third, fourth year of developing your budget, the conversation is going to be a little bit different. We're really going to be focusing on still what's changed in your life, but then how as a team do we make sense out of what that means for what regional center would be funding. So that's when we'll come back to like that traditional services blueprint. Here's some things that as a team we agreed made sense. Has something changed about this? And what would that look like under traditional services if we were changing what someone's support system looked like? We'll come back to that conversation. Having a traditional services blueprint allows us to think about rate changes. How would rate changes affect what you have access to in a 12-month period? Since we're keeping things separate, continuing services versus those one-time services, we can talk about adjustments related to that every year. And then of course, no one's life stays the same from year to year. So there's always going to be that conversation of, is there anything new or different in that person's life? And then from there, hopefully you're good to go for the next year, and you can get to work on your spending plan with your second year budget or third year, or whatever it may be. We just did a third year budget. I think our first one in San Diego this month. So that's exciting. So that's the process for San Diego. And like I said, it's different at every regional center. But we have found this to be a way that we can kind of make sense out of what we know from the law. Obviously, we want the family and that participant to be the prime part of the conversation, right? Involved in that conversation. And how do we move forward as a team on something that we can all agree, meets our responsibilities across the board. So hopefully you all found that semi-helpful. And I will, I guess I'll turn it over to you, Judy. I don't know if, I can't really take any questions, but if there's anything in the chat, like someone misheard me or something, I can look to see.
Yeah, I mean, I don't actually see a huge amount of questions for you in the chat, which means you must have been very clear. With the exception of one from Connie Boyer, who, well, actually a couple just came in. This is a great question I never thought about before. The program START that you use, which is for a crisis team, is that considered in your budget or outside of the budget?
Yeah, so the crisis teams are funded, and they're funded differently depending on the regional center. So it's really something that I would have to say, like, hey, talk to your specific regional center about how that funding is built in there, because it's different everywhere. But it really comes down to whether or not it's something that's part of those purchase of service expenditures.
Yeah. So for folks to understand, the reason why some things are part of your budget or not part of your budget is those pieces that are not part of your budget are not federally reimbursable. So that means we don't get to match the money we provide by the state with the federal government, with federal funds. So those are things like the paid internship program, which is completely a state funded opportunity, or competitive integrated employment. So, or Copays. Those are things that just the state of California has decided are important, and therefore you will continue to have access to those things, but they will not be part of your annual budget. Everything else, all the other services that you get at the regional center are all matched by the federal government. And therefore and by the way, crisis services is something that can be matched by the federal government. So it is possible that that will be in your budget. So I do think that it's worth exploring and asking folks about it. Somebody just asked a quick question via Bara. If I do not use all of my first year budget, is my second year budget the same as the first year, or is the second year budget only what I actually spent from year one?
Yeah, I can't necessarily answer that question for, an individual circumstance. I mean, the one thing that I just wanted to make sure was out there during the presentation today is that second year budget conversation is going to be a little bit different than the first year, but work with your regional center on what their process is for that. It's still the same law that we're following, right? So it's just an individualized conversation.
Yeah, and I think that what I would say is that especially during COVID, when so many things that you put into your spending plan may not in fact be available because of COVID, that you can clearly make a case for unmet need, that you weren't able to access this because group programs, in the community were shut down, or the gyms were shut down, or whatever. I think that certainly DDS has given an indication to regional centers to take COVID into account when establishing year two budgets if you haven't spent your entire first year budget. So, I mean, is that certainly what you guys are thinking about, Susie?
Yeah, I mean, we all know that COVID has made everyone's life very different for the last 12 months. So I have not yet, what I will say is I have not yet been in a budget meeting where we haven't talked about the impact of COVID. So I think that's across the board for all of us right now.
Great. So I want to thank you, Susie. I'm sure if there are going to be questions that come up, that I will send them your way, if that's okay.
Yeah, absolutely.
And everybody should just remember that this is the way San Diego does it. It doesn't mean it's the way your regional center does it. The reason why I asked Susie to come is because I loved how it was very forward thinking and using your person-centered plan to figure out where it is you're going in your life, as opposed to just looking at the last 12 months. So thank you so much, Susie. I know you have to go. And I just want to say that she mentioned to me before this started that at her last Zoom meeting that she presented, her pet pig came in and bothered people. I was very excited about the possibility that was going to happen. So if you could I don't know, do you go Suey? What do you do to call your pet pig? I'm not really sure, but. Yeah.
I've got her so far away from where I'm at right now because she's very loud. But I know there's some people in this room right now that were at that meeting where that happened. So just in case anyone's wondering, she's still doing just fine.
That's so great. Well, thanks you so much. Thanks, Susie. And I look forward to seeing you again soon. Take care.
Talk to you soon. Bye-bye.
So everyone, what we're gonna spend, I'm happy to try to answer any questions. I mean, I can't particularly answer the way, questions that she would answer about the way her budget tool works, but I can answer sort of general questions around it. The other thing I can do is try to answer, and there are others in this call who can try to answer any of your other questions about the individual budget, unmet need, and change in circumstances. I see the names of all the people in this call today, and there's some really great independent facilitators. I think Mitchie Gates is here. I saw her name in Yay. She's an amazing executive director of Kern Regional Center. I know she's not prepared to speak, but Mitchie, you're always welcome, and you are always welcome to say anything you want at any of our meetings. So, we're here to present, to try to have people understand where regional centers are coming from, so that when we meet with them, we are understanding that what they have to say to DDS to justify where a budget is, and that we have to be prepared to justify what we're asking for so that they can justify it as well. So I'm going to start with, I see that some people are direct messaging me, and I'm going to say it once again. I prefer you not direct message me during these meetings because I don't have time to answer your private questions. Feel free to ask the question to Ed Herzl, who's managing this meeting, and she'll present it to me verbally if you need it to be anonymous. or you can just put it in the chat and she'll also ask it that way. I just don't have, I can't multitask. I can't listen to what's happening and answer private questions. So Ed, why don't we get started in getting some of these questions out there, if you don't mind?
Certainly. Let's start with our first one, which is anonymous. Judy talked about doing the online certification of IHSS. I believe this is referring to a previous talk, to get $3 more per hour. And she also talked about the extra $500 as an IHSS provider bonus. What happened now? I did not hear anything from my local IHSS.
Yeah, so the answer is I don't know. That is something that's not part of the DDS system. It's part of the Department of Social Services system. I'm not sure where that ended up, and I'm not sure what's going to happen. It is an excellent question. Nina Spiegelman, could you add that to a list of something that we might want to ask around about? And when I have an answer, I will present it on STP Connect. That's a very excellent question.
Thank you very much, Judy. So the next question that I have on here is, I request another anonymous question. I requested the budget to start self-determination on July 20th. We are in transition, so I was told they would try to include some projections in the budget. The last communication from the regional center, Alta, is that our service coordinator has received my son's budget, but it needs to be reviewed prior to us meeting to go over it and confirm it. Is that accurate? Who might she think she needs to review it with before the consumer? We have not yet done the PCP, so I wouldn't want to sign a budget until after we determine if there are unmet needs, correct?
So this makes my head want to explode when I hear crap like this. This is what I love about Susie Reckworth. Did you see her slide where she said, the budget is a discussion. It's a conversation. It's a conversation about the last 12 months, and it's a conversation about the next 12 months. It is not the regional center goes and decides what your individual budget amount is, and then they have some secret review committee look at it, and then they give it to you as if it's absolutely predetermined or fait accompli. That is not the way it's supposed to work. If you look at the Landerman Act, which is what Susie was quoting from, it is supposed to be a team approach, an IPP team approach to decide what the individual budget is. It's not some secret committee who decides it. So you should, the person who asked this question and all the rest of you, should be asking for an initial meeting to discuss your individual budget amount. It doesn't have to be a meeting where you're certifying your budget. It is just the first conversation that you can have. And if your service coordinator is telling you that she or he is not allowed, or they are not allowed to have that conversation with you until this committee meets, say, I don't want to wait. I want to have this conversation. I want to get started. And I'm not expecting a final decision to be made here. So please, and if that is a problem, then I would recommend you go to your local advisory committee meeting and you speak to the individuals who have, who are there to represent you. They're there to provide oversight. Tell them the barriers that you're facing in starting the self-determination program, and they should understand that they need to follow the law.
Thank you, Judy. I have another question. What is the time frame? We've kind of already sort of addressed this, but I want to ask it again. What is the time frame we have to use the budget after we start the SDP? Since this is a separate person, we didn't really get clarity the last time. The budget is for 1 year. So if a family waited for the right time to actually use the budget because of COVID, are they supposed to use the budget within a year? And after 1 year, do they have to start a second budget for the second year?
Yes. So the day you start into self-determination, the clock starts ticking for the 1 year. Please don't think that if you are like a month or two away from the year being done, that you have to go on a spending spree and spend the rest of your money. Because if you haven't spent the money, there's a reason for it. Usually now the reason is COVID. And at your budget meeting for year 2, you should be saying the word COVID or the phrase COVID constantly. It is unmet need. We had in the spending plan that we were going to join a gym, but it is not safe to be at a gym. We had in the spending plan that we were going to have, we were going to look for a job, but we didn't want to look for a job at this time. So all of those needs that were addressed in your person-centered plan still exist. COVID didn't erase those needs. Those goals and needs still exist, and that funding should remain in your budget. If you ended up not using all your budget because you decided, or you not decided, but it's just your needs were being met with a lower amount, then that's great too. We don't want to be overspending in this program. We want self-determination to stay for a very long time. So I'm worried, I'm worried that people are seeing, oh my God, we didn't spend the money. We should go and change our spending plan to buy all these things. Please don't do that. Everyone notices that, and it really hurts the whole program. You should be deciding what your goals are for the year. Try to meet those goals in various ways. You can certainly change your mind, as anyone does over the course of a year, on how you want to meet those goals. Or your goals may change because of a change in circumstance in your life. But if you are not spending all your money and there is a legitimate reason for it, those funds should remain in your budget for year 2. Did you want to I know, Ed, that Ryan had a question. Did he type his question to you as he did last week?
He did. I want to make sure that all parts of the question are present. So Ryan, let me know if this is not your complete question. The chat's been moving really quickly today in my DMs. I have from Ryan. Let me scroll back up to find where I wrote his question down. I keep thinking about travel. I already did my orientation.
Okay. I keep thinking about travel too, Ryan. That's pretty much all I ever think about during COVID, is the fact that I don't get to travel. So Ryan, I think it's a great thing for you to travel. Now, what in the self-determination program can be paid for with travel? I believe that has not been clearly defined yet. I think that it is unlikely that paying for your travel expenses to fly on a plane, certainly to stay at a hotel, to rent a rental car, I seriously doubt that is going to be an approved expense. I have not heard from DDS a definite on that, but I seriously doubt it. But what can be paid for is that, let's say you want to go to Vegas for the weekend. The staff member who will support you to go to Las Vegas for the weekend will certainly, their time can certainly be paid for. The question is whether their transportation expenses can be paid for. And that issue came up recently. And if anybody is on here, you can put in the chat. Yeah, go ahead, Ryan. Did you have another question about that? Because I'm not sure if they'll pay for that. Let us know if you have another question. You can type it in the chat. Okay, Ryan? Okay, thank you.
Would you like another question from chat, Judy?
Yeah, yes, while Ryan is typing, that would be great.
Certainly. I have an anonymous question. I've been told reimbursement is not allowed, but there are some regional centers stating that reimbursement is allowed. Does Judy have any insight to this, or has something changed?
I have heard that reimbursement is never allowed. So I'd also be interested if somebody has been able to get reimbursed through the self-determination program. I would like to hear from you what the circumstances were, and the FMS was who did that. If you could just put your name in the chat that you would like to answer that, because I now have all these questions with hands raised, and I'm not sure if any of you are actually going to be answering that question. Ryan, did you have another question before we go to the next person?
Yeah. Yeah.
Are you typing it to us, Ryan?
Yeah.
Okay, so Ed, does he usually Ryan types to you directly, right?
Typically, yeah, Ryan, typically you do type to me correctly. So I will, or excuse me, directly, not correctly, I misspoke. And so I will keep an eye out for your question in the chat if that's okay with you.
Yeah.
Okay, thank you, Ryan. All right, I'm gonna call Ken, oh, who's next? Yes, Ken Curry. Go ahead, I'm asking you to unmute.
Okay, now. Am I unmuted?
Yes, you are.
Okay. Hi. In regards to ABA services, it seems like that's a specialized service. If an individual chooses is budgeted for ABA and then chooses to withdraw that, it's my understanding that that can't be transferred to another portion of the budget. It's just instantly removed.
No, that's
your
not
understanding.
No, that is not true. That, in fact, I know of many, many people who have ABA therapy in their budget and are using it to address the same goals of behavior, but using it for other things that they feel will better help them, such as horseback riding, swimming, joining a gym, exercising, learning to type to communicate. I mean, these are all things that also address the same sort of behavioral goals that an ABA therapist does. And I've seen people up and down the state legitimately use their spending plan with those ABA funds. So if your regional center is saying you could only use the behavioral therapy money for other behavior therapy, then they are wrong. That is exactly the opposite of what the freedom of self-determination provides.
Okay, thank you very much.
Thanks, Ken. Let me just get Connie Boyer real quick. Hi, Connie. You can go ahead and unmute, Connie. You there? All right, Connie, we'll get back to you in a moment. Alphonse, go ahead and unmute.
Thank you for giving me the chance. Regarding refund, or when we wanted to buy laser printer toners for the paperwork and things like that for employees and for the spending, I got an approval from the coordinator. So I went out and bought the laser printer from Amazon.
Mm-hmm.
And I submitted it to the FMS and it was disapproved. There was no refund.
Mm-hmm.
Of course, we did not understand the process. The process was supposed to be, as we later understood it, and it was explained to us that it had to be approved to be in a spending plan. And then we have purchase, and then we submit the receipt. So I paid $580 from my own pocket, and I learned my lesson.
Yeah.
So this is just for sharing. Thank you.
Thank you, Alphonse. Lesson learned. My understanding is the federal government does not allow reimbursement, although I have yet to find where that is in the waiver or in any other Medicaid regulation. If somebody can find that for me, I'd like to see it. But you all should know that FMSs in other states do provide reimbursement. So that's why I think it's not a federal rule. It's something that here in California they're requiring. So, if you want to purchase like that laser printer that Alphonse wanted to for the staff, what you would need to do is to find the exact laser printer you want on Amazon, send the link to your FMS, and say, please purchase this for us. Now, certain FMSs make those purchases faster than others. However, you know, one of the questions you should ask when you're interviewing FMSs is, if we want to purchase something in a store or online, how do we go about doing that? And what do you do for us? So I think that's really important to respond to. So, okay, so let's take some more questions from the chat, Ed.
Sure. Just 1 second. I want to get clarification from Ryan on whether or not he wants his mom to voice for him.
And I want to tell you I'm unmuted now, Judy.
Oh, go ahead, Connie. Perfect timing.
Thank you. Okay, so my question has to do if quality of service considered an unmet need? For example, supported living staff, direct professionals may lack the skill set, and I'm talking about on a continuous basis over the years, to meet very challenging behaviors, even when training is offered. Must they get either a health and safety waiver to get a higher rate of funding? Or in this new system with self-determination, can we say that that's an unmet need because the SLS is not being funded enough to hire a higher skill set person and also to retain them? Because the more challenging behaviors you have, the harder it is to find in that employment pool or to retain staff. So is that considered an unmet need, or do you have to go in a different way, health and safety waiver?
Yeah, it's not considered an unmet need, Connie. I know you've been asking me this question for a couple of years, the very legitimate, difficult question. It is not considered an unmet need. You really will need to ask for the health and safety waiver in the traditional system so that the rates that would be provided in the traditional system would be the matching rate that you would have for your budget. I've seen it on many budgets. I have seen many budgets honor the health and safety waiver that people receive in the traditional system. So, but that is really, and by the way, a health and safety waiver, for those of you who don't know what it is that you have to make the case that paying, you know, close to minimum wage, which is the traditional, let's say, supported living amount that providers are paid, that your direct providers are paid, that you have to make the case that because of the individual's health and safety, that you need to have a higher rate. So you have to look at, you know, maybe they have a G-tube, maybe they have regular seizures, maybe they have some challenging behaviors. Maybe they have had, maybe they run out the door going to someplace. So these are things that when you hire a person who maybe is, you know, is just going to be paid close to minimum wage, you're not able to attract a higher level person with a higher level of experience. So I would say that you should, that it's a process. It's sometimes a very long process to get your health and safety waiver approved. But the case that you cannot make is we can't find any employees because the cost of living is high. You can't make that case because the case needs to be made about that individual person with the disability requiring a higher level of need than would normally be paid for.
And that is tragic because they are failing even in the self-determination system to look at the cost of living, the geographic area, and that it might be impossible to find, the employment pool is just not there to hire people. And I'm not just talking about SLS, it can be day programs, it can be a nurse. I wish there was a way that we could address this when you live in a very expensive area. There's no way through self-determination to address that?
There is no way in self-determination to address that. Our budgets are based on the traditional system. So if there is a way in the traditional system to address that, we benefit from it. Everybody should remember that the biggest win out of the budget, the state budget this year, the service providers. While we got very little as people with disabilities and family members. We got social rec restored, even though who the heck knows when that's going to happen. And we got one other lovely service for people who stay at home, who still need supported living, who stay with their parents. But other than that, $1.4 billion annually will be provided for rate increases to service providers. So supported living is about, over the next few years, to get a 40% rate increase. And day programs are getting rate increases, and nurses are getting rate increases. And virtually every service, with the exception of a few, are getting, and some of them are getting very, very substantial 80, 90% rate increases. So some of this is going to improve over time, and will certainly increase people's budgets in the self-determination program. I do not know whether they're going to have variable rates depending on where you live. Like, are they going to have a higher rate for people who live in the Bay Area versus people who live in Central California? I had heard that they were taking geographic differences into account, but I'm not sure how that's going to work. So wish I could be more helpful, Connie.
And one other question related to that, is there any provision to make sure that these increases that are going to providers will trickle down to the direct service people in the day programs and the SLS? Because what I have heard is that, and I've heard this from the directors, that the money going to these programs may not trickle down to the actual staff. That scares me a great deal. Is there any way we can do anything about that?
Yeah, so Connie, it infuriates me that the legislature did not require it in the budget that when providers got a rate increase, that they had to put it all into direct service professionals, the direct support professionals, the people who are actually working with the individuals with disabilities. Right now, their DDS is writing the rules and regulations around the rate increases. So what can we do about this, Connie? We should be advocating to DDS that as they write the rules around rate increases, that they put into effect a regulation which requires the service providers to put all of that money to the direct support professionals. And so we haven't lost this fight yet. It's certainly something DVU is going to be fighting for because we don't just work on self-determination, everybody. So, but we're going to be fighting for that for the 99.9% of people in California who are still in the traditional system. So thanks for bringing it up, Connie. I'm going to go back to you, Ed, with some of the questions I see moving through the chat.
Yes, Ryan is asking me to call on his mom. I am going to find her.
Okay.
Karen, I've unmuted you. If you can unmute, please. Karen, are you there? All right, it looks like Karen is not responding. Ryan, when your mom gets back to us, I will make sure that we get her question answered. She's just not unmuting at the moment.
Yeah, I am now.
Oh, okay. Hi, sorry, Karen, glad you're here.
Sorry, I don't know how to work this technology as well as Ryan does. So, I just thought it would be helpful to explain that when Ryan asks about travel expenses, he's asking about travel expenses related to an alternate day program that was approved by DDS because there isn't an appropriate day program for him where he lives. And his alternate day program is traveling to conferences to give speeches on augmentative communication and other things, and to sell the products of his micro business. So in the traditional services, his travel expenses for himself and his staff, including plane, hotel, accessible vehicle or public accessible transit, whatever, are paid for in the traditional services. So he doesn't understand, and Ryan, tell me if I get this right, he doesn't understand why they couldn't be paid in self-determination if they're already approved by DDS.
Ooh, I love that, Ryan. Let's talk offline on that because I don't believe that DDS has ruled on this issue. And so this will help us make the case that we can continue to request this. So I like it. I like it. I would say that part of it is that you're not using these travel expenses, Ryan, to go on vacation.
No.
So that is what I was thinking of in my head, and they're not going to pay for you to go on vacation. These are legitimate expenses for you to do work. You're working when you're going to these places. So that to me is a very different argument to make that you could put in your spending plan and should be part of the budget. So let's just make sure that we, as we're discussing travel expenses, that we distinguish between traveling for work and traveling for fun. Okay. All right. Thank you, Karen, for explaining that. Thank you, Ryan. Appreciate it.
And how do we carry on this discussion offline? Do you contact us?
Oh,
or do
Ryan, Ryan knows how to reach me so well.
Okay.
Yeah, he does. He knows my contact. All right. Thanks, Karen.
Mm-hmm.
Okay, go ahead.
All righty. So moving on to the next question. Let me just scroll back up here. I have from Melissa, under service description, how is that different from what is in the regional center budget? Also, why are the service codes different from the regional center budget? It's been confusing.
Okay, well, we don't want to have the same service codes as the traditional regional center system because there's only a few things they're allowed to do. Regional centers are very restricted in the kinds of services they can provide. And we in self-determination can do gobs of wonderful things. So, we don't want to have the same service codes. But where I can say is that is that we have too many service codes in the self-determination program. I've been advocating for far fewer so that when you're trying to change something that you're doing over the course of the year in your spending plan, that it doesn't become a big ordeal to change your spending plan because it's all within a few service codes. So that is something I can promise you that we've been trying to really change over that we're advocating for. I also just noticed that Rick is here. So Rick, I'm gonna ask you to unmute because I'm always tired of answering questions. So how do I ask you to unmute?
I got it.
Yeah, thank you. Got it. Yeah, just so Rick, if you can stand by, just because I get tired of answering the questions and you know all the answers too. So Rick, do you want to say what you had just typed in the chat about traveling to conferences?
Yeah, I think it's an interesting question. Travel to conferences out of state is not an approved expenditure. And you know that assumes that you're a participant, that you're traveling to learn something, for example. What I don't know, because I've not actually thought about it or have seen it yet, is well, what happens if an out-of-state conference asks you to speak, present, whether for compensation or not? And, you know, if that can fit into that which you do for a living or that which you do to earn compensation, my thinking about it is that it could be an exception. I just don't know. I've not faced it before. I've not actually addressed it.
Certainly, if you've been asked to speak at a conference out of state, you should be asking the people who asked you to speak to pay for your travel expenses, including the travel expenses of your staff. However, they're unlikely to pay the hourly rate of your staff going, and that you can definitely use your self-determination program for. Okay, let's keep going. Stay on with us, Rick, so that I get a break sometimes. Thank you.
All right, moving on to the next question I have from Magdalene. Who can I talk to about copays?
Copays. So copays are still allowed. They're just outside of the self-determination program. So if your regional center is making some case that if you go into self-determination, you can no longer get your copays paid for, then they're wrong, because it is happening all over the state. So you should be, if you are having any concerns about that, you know, bring that up here at this meeting.
Thank you for that, Judy. Next.
Let's go to a question from Amparo, if that's okay. Go ahead, Amparo. Dallas.
Thank you. I just wanted to discuss the same situation the other lady was talking about. The providers are getting their rate increase, but the quality of employees that some of us receive are really understand, you know, they're just below standards. And then the ones that are good, how could they survive on what they're even paying them? And what is that going to trickle down to? Supposedly we're having a meeting the 23rd that some regional centers are backing up. And then of course, California Disability Rights that's the one that's throwing one, to have direct rate increases, because some of our staff members are doing much higher level of care, like the ones I have. You know, my son has excessive seizures, but I'm severely understaffed, not because, you know, the quality, when they send me unqualified people, I'm not gonna deal with that. You know, that's just not acceptable for me. It's my son's safety, but being an unmet need is a severe one. So what you discussed before about, can you please repeat that waiver that you talked about, that health waiver? Because I need to ask my coordinator to do that, because this isn't working. My son's supposed to have at least 16 workers, you know, around the clock too. He's a 2-on-1 plus the LVN. And then I do all the RN work, but I have 6 people working. I'm doing 24-hour shifts alone with my son, which is unacceptable, you know, and to do the paperwork to move over right now, I want to support my providers. I want to support my regional center, but this is overwhelming me even worse.
Yeah. So the way that self-determination works for staffing is very different than the way it works in the traditional system. So you're not using an agency. So the rates for agency are much higher than the hourly rate they pay to the actual worker. So let's say you're using a supported living provider. The rates are negotiated between the provider and the regional center. And sometimes it's different depending on which regional center you're at. But the rate could be as high as $35 an hour.
Yeah.
And yet the providers may be making 16 or 17. So where is all that other money going? All that other money is going to maybe a supervisor. It's the person who's doing the scheduling. It's another person who owns the company who makes a little bit of profit. It goes to taxes and liability insurance and workers' comp and some profit, right? And so you all in self-determination get that full $35. You don't have to hire an agency. You can hire the workers directly. And I'm going to maybe throw in Rick here, because Rick has a son who has a lot of needs, who is not in supported living, but they hire their own workers. So Rick, why don't you go ahead and talk about how you guys do it? Oops. Well, I think I have to, when you mute yourself, I have to give you permission to mute again, unmute. Oops, there you go, perfect.
Yeah, so, well, this is chronic, it's acute, it is systemic. And self-determination is not going to solve all those problems, but as a practical matter, you know, employment costs are what they are. And an agency, for example, may be required to offer employees health insurance, which is an additional cost that you may not necessarily offer. Now, I'm not saying that's a good or a bad thing. It's a competitive marketplace. What we have done in our plan is in the most recent renewal of the plan is that we have had an across the board increase in wages. We provide some benefits, but the cost of employment is nowhere close to $35 an hour. And I know that many agencies receive payment from regional centers in the traditional system at that rate or around that rate, higher than that rate. I've always thought of self-determination, if you're willing to take on the responsibility and the difficulty of managing a bunch of employees, and we manage 6 of them. It's an opportunity to save the state money, and that's how you pitch it. They're not going to pay as much as they otherwise would if there were an agency. In many, many areas of the state, there are no agencies serving folks who require care provision. We think of the state as being urban and suburban, but there are vast areas of the state which are not, and therefore people are on their own. So we're not going to solve the problem other than by being creative. Now, if you call it an unmet need and that flies, then it's an unmet need. If you call it something different or don't call it anything at all other than that you are not able to find employees because there simply aren't any out there at the wages that are being offered, you can make a pretty compelling case that the regional center needs to do what's necessary to accommodate you, because it can do no harm. It must do no harm. And so the alternative, and every once in a while I've thought of using this as a threat, although I've never needed to, and that is if a regional center can't provide what we need locally in order to keep people, and everybody on this call knows how difficult that is. I've thought, well, I should go back to the regional center and say, here, this is your problem. We're going back into the traditional delivery system. You take this on. You can't do any harm to my child. And therefore, you're going to have to figure it out. Well, I'm in a great regional center and have been in the pilot for 21 years, and therefore I have not ever had to do that. But it's really a matter of being an advocate and being creative to the extent that you need to. And really, I'm thinking about some of the other things that we've talked about. A lot of this is how you present that which you want or need in order to allow it to fit either within one of the categories or within one of the service codes, or to provide a rationale for or in support of what you are seeking. I don't know how to solve this problem because we live in fear, as do all of you, that we're going to lose somebody and not be able to find somebody to cover, or that we're going to have to pay extraordinary overtime in order for people to fill in for somebody who is no longer available. And that can be temporary due to COVID. It can be permanent due to people just simply leaving and finding better opportunities.
Yeah.
I hope that helps. But Ed,
But what was the name of the health one, so I can put it to my coordinator?
right. So it's called a health and safety waiver.
Thank you.
And I noticed discussion in the chat, and I appreciate people reminding me that in the traditional system, the health and safety waiver is submitted by the service provider, where they go to the regional center and say, we cannot provide the level of support to this consumer at the rate we are currently getting, and we need a higher rate. How does it work in the self-determination program? I have no idea. If there's anybody who has an answer to that, I'm not sure. But remember that, but I do know that people who came into, Connie and Harvey, do you know how, if somebody's already in the self-determination program, how they would request a new health and safety waiver, Harv?
Unfortunately, health and safety waivers are attached to a provider, not a human being. Not attached to a person.
Which is crazy.
Ludicrous.
Yeah.
I'll give you an example. We had a health and safety waiver in 2007 and 6. Right. Left the program that I founded and found out that that we had to go through the process again, 100%. And that took about a year. Okay, so that's another thing to work on, is health and safety waivers are people.
Right.
And I have no idea how they got to that point that they attach it to a provider. But the issue is you better document, because it really goes back to the IPP, not just the PCP. It really does.
And also that it should be available for people in self-determination.
Absolutely.
So
I think it is, but it's a long process and a lot of documentation.
and supposedly they've streamlined it, but
I haven't heard
I don't
if
know.
they have.
I'm
You
so
may
glad.
you may know, Judy, if there's a lot of people in self-determination, probably they had the health and safety waiver
Yeah.
already.
Yes.
And it jumped over to it.
Yes, that's exactly, you're right, Harv, you're right. So this is every week I learn something new that should be brought up to DDS about self-determination. And so Rick, maybe you and I can bring this up as an issue that needs to be discussed, just people who don't currently have health and safety waivers, how do they get one? And that way it will be tied to the individual, not to the provider. So that's helpful. Thanks, everybody. David Wiles, go ahead and ask your question.
Well, it's actually not a question, but it's it's what we're trying to do. We have had specialized tailored services for my son that we got through an unvendored agency. So I have to come up with.
I have to put on my vote. I voted sticker. You inspired me. Sorry.
Well, you and Alan inspired me.
Sorry.
At any rate, besides no on the recall, we have. So I have to come up with money every month, put it through the regional center system, get reimbursed, and then pay it to this unvendored agency. We are going to continue with this agency through self-determination, and they're going to be paid directly by the financial services committee. So I will hopefully, and we're only 2 months behind in getting reimbursement from the regional center. So I hope to catch up and then actually get reimbursed for the final time and get our original money out.
So that's interesting. That is definitely one way of doing it. Is you can use an agency, even if it's an unvendored agency. You can use an agency in the self-determination program. You don't have to hire your workers directly, but it sounds like with this agency, you do have complete control over the workers for your son, right? Yes. So that's one of the things you want to make sure is that if you're using an agency, that you do have control over the workers.
It's an agency of two.
Right. There you go. Perfect. I've heard of other people. Yeah,
they both work with Rio.
Yeah, that's great. That's perfect. Well, thank you for that, David. Good to see you.
Good to see you too.
This is fun. So David and his son and I went to Ireland together many years ago. And the next person to ask a question also went to Ireland with us. Susan Eustaris. Go ahead, Susan. Can you unmute? Having a little reunion.
Unmute. Hi, how are you?
Hey, hi. Top of the morning to you.
So my question is, I just finished a second PCP. The balance on the budget, they always state don't pass even $1. But this child has unmet needs. I even put it under the spending plan, under the budget unmet needs. They need ILS, they need PAS, and they need floor time because they already consumed the Medi-Cal on floor time for adults. So what my question is, why are they always, it's a big deal that you pass even $1 on the second PCP, that if the child has more unmet needs, and then I even put it in black and white under the spending plan, but they never put it in black and white that, okay, we will meet these needs when it's coming maybe in October, present it to us and we will try to consider it in this budget, but they never put it in writing.
Well, you need to have it in writing in case you need to go to fair hearing over this, Susan. So, once again, no one should be making decisions outside of the IPP team. These are the things that I've been hearing that are very disturbing, and actually found out that this happens in the traditional system all the time. But if you look at the Landerman Act says that the planning team determines services and supports that are appropriate and help meet the IPP goals. So if some mysterious committee, or, I've heard really weird terms for what they're called at different regional centers, are secretly meeting and making decisions that apply to the individual, and that we don't even know who they are, they're not part of the planning team, then that's really a problem. And you should ask for a meeting immediately to have a discussion. Like Susie said in her presentation, it's a conversation. This is a conversation we're supposed to have about the budget, to talk about unmet need. And if they say we don't come to an agreement as part of our planning team meeting, okay, then you can go to fair hearing on it. But it shouldn't be happening behind closed doors where you can't even make your case.
Exactly. Okay. Thank you, Judy.
Thanks, Susan. Good to hear from you. Okay. Go ahead. Back to you, Ed.
Certainly. So the next question that I have is actually one in Spanish. I have popped it in the chat again for Lorna's convenience right now. And Lorna, if you could please translate Rosa's question in the chat for us that I've just.
Or if it's easier, you can just speak it, whatever you'd rather do.
Oh, yeah, I'm sorry. That's what I meant. Yeah.
Okay.
If you could speak it aloud.
All right, she's looking at it right now, everybody.
I can hear you, Lorna. I can hear you, Lorna.
I cannot hear you because I forgot to put English. Yes, I went back and picked a channel. I had turned it off at one point. Sorry, go ahead, Lorna. That's a great question. They would not deduct the amount. You would just make the choice to spend that money in a different way. And you would have to change your spending plan. So you need to tell your service coordinator and your FMS how you want to change the funds. So let's say you put down an art class and you change your mind and want to take a theater class. We're all allowed to change our minds. You just need to tell your FMS so they know where to send the money. And then you need to tell your service coordinator that you're doing that as well. Okay, it's should be straightforward. However, it seems to not be at any regional center.
Well, Judy, and it also doesn't need to be spent within the same service code.
Right.
So if, for example, the art class, for whatever reason, that expenditure is either not any longer needed or necessary or desired, but then it turns out that in order to meet the health needs of the participant, you need to buy a generator, for example, to provide power in the event of a power outage. Entirely different category, right? But and so there's an opportunity during the year to actually amend your budget, amend your spending plan, I should say, because the budget is what it is, to effectively spend your money toward or on something different entirely from that which you're not spending your money on, so long as it fits within the categories, the broad categories that are set forth in the waiver, as well as the specific line items which translate into service codes.
Thank you, very helpful. Go ahead, Ed.
Lorna, I have another question that needs translated. If you could please assist us. Just posted it in the chat.
It's the next to last one. Yes. So when a person goes into crisis in the traditional system, you would have to ask for a meeting with this regional center to ask for additional services. Things are no different in the self-determination program where you have a change in circumstance, right? Where a person has changed, they're in either a health crisis, a behavioral crisis, or something. And you ask for an urgent meeting with the regional center, and they should be increasing your budget. It may be temporary if the crisis is temporary, but they should be increasing your budget based on what services you would get in the traditional system. So let me give you an example of how it might work. So my son many years ago was in a car accident. We went to a regional center immediately, said when he comes home from the hospital, he's going to need 24/7 care on top of what mom and dad can provide. So they approved a 24-hour care for like 2 weeks. And that was all that we needed. So don't think that your budget is going to, have this 2-week increase forever. It's just for the time that that person is in crisis. And if that crisis doesn't end for a while, you'll have to probably keep going back and asking for additional services. So it's a temporary increase in the budget. You may have a very specific part of your spending plan that you change, that you would say, increase in staff or increase in nursing services or something along those lines that you want to pay for. But the regional center has to certify that those funds would have been paid in the traditional system. And in a crisis, that's very easy to make that case. All right. And another question. We probably have time for just one more.
Sure. Would you like to take from the chat or from Benita?
Benita, you can go ahead and try, and then we'll see. You can look through if there's one like urgent question we might be able to get to.
On it. Mm-hmm.
Mine can be quick, Judy. Can you hear me okay?
I sure can.
Okay. So it's just a clarification question that you talked when we first got the budget, and it talked about when we got back social rec and activities, right? For regional centers.
Mm-hmm.
The question is twofold. One, is there an age? Is it for all clients? Or I remember you talked about it was 3 to 17. So if it's 3 to 17 and to all clients, the second part of that question, Judy, is do we have to wait for clarification from DDS in order to add that to our budget going forward? Because that's what we're hearing from our Regional Center. I'm not going to say who it, you already know who that is. But anyway, that's my question.
Yeah. Oh, Benita. Yeah, so it actually social rec is for all ages. I might have misspoke at meetings a month or two ago. There are certain services that were restored, which are just for 3 to 17-year-olds, but social rec is for all ages. But the regional centers are waiting for direction on this. I have heard that there is some movement at DDS to provide that direction, because you can imagine that there's a lot of people in the traditional system who want to get access to these services too. So once we know what services are going to be approved for in the traditional system, we can go in and say, so let's say they approve swimming or they approve gymnastics or something like that. You would go in and make the case, in the traditional system, my child would want to be taking horseback riding or swimming or something. And then that dollar amount would go into your budget. And then you could actually spend it on whatever you want. It doesn't have to be on gymnastics or swimming. All right. But yeah, we don't know yet. Sorry. All right, one more quick question, Ed, from the chat.
Sure thing. Let me grab a quick one real quick. Okay, here's a good one from Maria. I'm confused. Can a person-centered planner or independent facilitator be our service coordinator, or do I need to hire somebody? I would like to save money from my budget for other services.
Okay, so first, let me say that for when you're first entering the self-determination program, the money for your person-centered planner does not come from your budget. So don't think initially that you need to save any money. All right. There is $2,500, up to $2,500 to hire an independent facilitator, or they're actually calling them person-centered planners, through the traditional system, service code 024. You can hire this company or these individuals to help you through the process of transitioning into the self-determination program. Once you are in the self-determination program for year 2 and beyond, the money to do person-centered planning would come from your budget. I can promise you, though, the amount of time and effort needed from an independent facilitator is far greater moving into the program than once you're continuing, unless you have a significant change in circumstance, like you're moving out of your home, or you're moving in, or you may be leaving school. You may want to hire an independent facilitator to do a very robust planning process for those. But Rick can tell you, who's been in the program for over 20 years, that the person-centered planning process, once you've been in the self-determination program, is much smoother, and often you don't even need to hire an independent facilitator. What do you think, Rick?
Well, that's true. Unless there's a significant change in circumstances, the amount of time that is spent and the expertise that is required is it just gets less and less and less and lower every year. We fall into a trap sometimes, or into this space where we don't have, where things never really change. And one of the things I really promote is to take a good long look every year at your circumstances to see what might be different. Because otherwise you're sort of checking boxes like they do in the IPP process. And self-determination should not be that. It should be provide the opportunity. It does provide the opportunity to simply have a review of your life and the life of your family. And you'd be amazed at what happens when that occurs, when you really sit down and say, well, what are my goals this year? Are they consistent with the goals that I had last year and 5 years ago? What has changed? What's missing? What would be better? What can we get rid of? Meaning to put our funds toward something different. The self-advocates, family members, peer support, people within their support group and their peers, as well as parents for those who have not yet aged up, or even parents of those who have aged up, are the best people to be able to evaluate the quality of life, the experiences in life that are important. And an independent facilitator can get you through the system, has access to and ideas about what services and supports will meet the goals and objectives. But I can tell you that process, which is can be very lengthy in the beginning, eases over time. And that is year 2 looks different from year 1. Year 3 is easier than year 2, and so on.
Thanks, Rick. I want to thank everybody who joined us today. We do need to end, we're a little over, but we do need to end on time because of our interpreters, our Spanish and Korean interpreters. We will be back again next Wednesday. I want to remind everybody of our schedule, that we will be here on the 25th. And I believe on the 1st, yes, on the 1st, but then we will be taking off 2 weeks in a row for the Jewish holidays. We will not be here on September 8th or September 15th, and then come back to you on September 22nd. But we will get that out in our emails. Go to our website if you're not already on our email list. I want to thank everybody for joining us. Thank you, Rick. And thanks to Susie, who had to get off. She was great. Appreciate everybody, and we'll see you all next week. Take care. Bye, all.